Facial medicine is the treatment or training of our mechanical body and the study of how we support ourselves, stabilize ourselves, move, develop, explore, and refine our structure, moving in and through the environment. In other words, manipulation is part of that, but walking, running, crawling, motivating in a wheelchair, all of those things are part of how we move through the environment, part of the things that we need to train. It's a baby. Can you see that? Just in the shape of the arteries. There's the veins in your liver, arteries in the arm, and that system is clearly centered in the heart and lungs. And for the rest of the time that I'm here, all of this morning, I want to focus on the fascial system or the fibrous system, which is the muscles and the fascia together. That system also, if I could wave a magic wand and nothing would be there but your fascial system, we would see the shape of the whole body. That system would be very thin and filmy in your cheek and in the breast and in the armpit. It would be very thick and dense in the Achilles tendon, in the bones. The bones, at basis, the bones are like leather, so is cartilage. But it would be a single system. So
when I bring my arm up here, to get full range of motion in my shoulder joint, I need adequate scapular upward rotation and elevation. Now, if my scapula do not move upwardly, then what happens? Any thoughts? So I'm looking at force couples now. Those of you, you took physics for a reason, right? The force couple in the shoulder is pretty complex. It's not just one force couple, there are tons. That's actually, I'll name you the three. The first force couple is the force couple between upper trap, mid trap, and lower trap.
Necessarily intended to be active.
Yeah, they should be quiet.
Yeah.
It's because, like I said, like a symphony, when you have good music, those instruments that are supposed to be playing should be playing. Some of them should be quiet. But sometimes the big brass muscles, I call them, the big superficial muscles, they don't know how to shut off. They're on all the time, drowning out the little guys. So this is the part where you're trying to bring back some balance or symphony pattern with the healthy baby. All right? So if you look at this baby here, he's about 4 months old. He's in like a squat position, which is a great alignment for your weightlifters. Okay, they have to be aligned very well to generate that force. Because this baby you have such a good stabilization in his spine here, so he can lift his leg up. Okay, so you can see his thoracolumbar junction is not extended. But if you look at this guy here, first of all, he can't even get his legs off. He is already in thoracolumbar extension. So what is not stabilizing him?
Certain spinal muscles. I would like you to be very, very discerning in using certain research, because sometimes less is more. Whether it was Claire, I think actually Tom, Claire, and Shirley probably all suggested that when you see big, giant paraspinal muscles, well, this is good, right? We have good, strong, big back muscles. Something that Collage would call sausages. This is not good. So the EMG is through the roof, but this is telling us something that's very, very negative. So please be very discerning in certain muscles, particularly of what I will in a few minutes talk about, the outer core. Okay, the outer core. To have a big EMG there, especially looking at it in isolate, is a. But this is how I believe you have a strong core. Okay, intra-abdominal pressure created by the diaphragm. We know if we breathe with the diaphragm, because we can breathe without it, and that's okay, I'm still exchanging air, but if I breathe with the diaphragm and create pressure in this finite system, this is how these inner core muscles turn on, without having to actually do some of the things that Johnson or the Queensland folks would suggest. Transverse abdominis turns on just fine when you breathe properly. And multifidus turns on because the pressure in these different directions as a result of the breath The right breath